10 signs of colon cancer you should pay attention to. Understanding colon cancer. Colon cancer, also known as colorectal cancer, originates in the colon, which is the large intestine responsible for transporting digested food to the rectum and out of the body. The development of colon cancer begins with the growth of polyps or abnormal growths in the inner lining of the colon. Regular screening tests can detect precancerous polyps before they progress into cancerous tumors. If left undetected or untreated, colon cancer can spread to other parts of the body. However, early detection, treatment, and advances in medical care have significantly reduced mortality rates associated with colon cancer. Impact of colon cancer. The colon consists of layers of mucous membrane, tissue, and muscle. Colon cancer begins in the mucosa, the innermost lining of the colon, which contains cells that produce and release mucus and other fluids. Mutations in these cells can lead to the formation of colon polyps. Over time, these polyps can turn cancerous, although it typically takes about 10 years for cancer to develop within a polyp. If left untreated, the cancer invades the layers of tissue, muscle, and the outer lining of the colon. It can also spread to other parts of the body through the lymph nodes or bloodstream. Affected populations. In the United States, colon cancer ranks as the third most commonly diagnosed cancer. Men and assigned male at birth, AMAB, individuals have a slightly higher risk of developing colon cancer compared to women, and assigned female at birth, AFAB, individuals. Additionally, colon cancer disproportionately affects Black individuals compared to other ethnic groups or races. While colon cancer typically affects individuals aged 50 and older, there has been a concerning increase in the number of cases among individuals aged 20 to 49 over the past 15 years. Medical researchers have yet to determine the exact reasons behind this trend. Recognizing the signs and causes of colon cancer. Colon cancer can manifest without noticeable symptoms. If symptoms do occur, it can be challenging to distinguish them from those of less severe conditions. Common signs of colon cancer include blood in or on the stool. Consult a healthcare provider if you notice blood after bowel movements or on the toilet paper, or if your stool appears dark or bright red. While blood in the stool doesn't necessarily indicate colon cancer, it is essential to seek medical advice to rule out any serious causes. Persistent changes in bowel habits. Consult a healthcare provider if you experience persistent constipation, diarrhea, or the feeling of incomplete bowel movements. Abdominal pain. Seek medical attention if you have unexplained or persistent abdominal pain. Although many factors can cause abdominal pain, it is best to consult a healthcare provider for further evaluation. Bloating. If bloating persists for more than a week, worsens, or is accompanied by other symptoms such as vomiting or blood in the stool, it is advisable to consult a healthcare provider. Unexplained weight loss. If you notice a significant and unintended weight loss, it may be a cause for concern and should be discussed with a healthcare provider. Vomiting. Frequent or unexplained vomiting should be evaluated by a healthcare provider. Fatigue and shortness of breath. Anemia characterized by fatigue and shortness of breath may indicate colon cancer. Causes of colon cancer. Similar to other types of cancer, colon cancer occurs when cells divide and grow uncontrollably. Normally, cells in the body follow a cycle of growth, division, and death. However, in colon cancer, cells in the lining of the colon and rectum continue to grow and divide beyond their intended lifespan. These cancerous cells can originate from polyps in the colon. The precise reasons why some individuals develop precancerous polyps that progress to colon cancer remain uncertain. However, certain risk factors can increase the likelihood of developing polyps and colon cancer. These risk factors include medical conditions, lifestyle choices, and inherited conditions. It is important to note that having one or more risk factors does not guarantee the development of colon cancer, but signifies an increased risk. Identifying these risk factors can help individuals assess their risk and seek appropriate medical guidance. Lifestyle choices as risk factors. Smoking. The use of tobacco products, including chewing tobacco and e-cigarettes, elevates the risk of developing colon cancer. Excessive alcohol consumption. Limiting alcohol intake is crucial, with recommendations advising men and AMAB individuals to consume no more than 2 servings per day, and women and AFAB individuals to consume no more than 1 serving per day. Even light alcohol use can increase the risk of cancer. Obesity. Consuming high-fat, high-calorie foods can impact weight and increase the risk of colon cancer. Red and processed meat consumption. Limiting the intake of red meat and processed meat, such as bacon, sausages, and lunch meat, to 2 servings per week is advised by healthcare providers. Sedentary lifestyle. Engaging in regular physical activity can reduce the risk of colon cancer. Medical conditions that increase colon cancer risk. Inflammatory bowel disease, IBD. Chronic conditions like chronic ulcerative colitis and Crohn's colitis, which cause inflammation in the colon lining, are associated with an increased risk of colon cancer. The risk escalates for individuals with long-lasting and extensive inflammation. Inherited conditions. Certain inherited conditions, including Lynch syndrome and familial adenomatous polyposis, raise the risk of developing colon cancer. Inherited genetic mutations can predispose individuals to colon cancer. Family history of colon or other cancers. Individuals with a close family member, parents, siblings, or children who had colon cancer are at an increased risk, especially if the family member was diagnosed before the age of 45. Family history of polyps. Individuals with a parent, sibling, or child who had advanced polyps, particularly large polyps with characteristics indicating potential cancerous cells, have an elevated risk of developing colon cancer. Presence of multiple polyps. Individuals with numerous colon polyps, including adenomas, serrated polyps, or other types, are more likely to develop polyps and colon cancer. This tendency can be inherited. Diagnosis and testing. How is colon cancer diagnosed? Healthcare providers employ several tests to diagnose colon cancer effectively. These tests include complete blood count, CBC, comprehensive metabolic panel, CMP, carcinoembryonic antigen, C assay. Elevated C levels in the blood may indicate the presence of colon cancer. X-rays, computed tomography, CT, scan magnetic resonance imaging, MRI, scan positron emission tomography, PET, scan ultrasound biopsy. Distinguishing between screening tests and diagnostic tests. Screening tests aim to identify cancer in individuals without apparent symptoms. When abnormalities are detected through screening tests, additional diagnostic tests may be recommended by healthcare providers. Common colon cancer screening tests. Colonoscopy. This is the most prevalent screening test for colon cancer. Other screening options include fecal immunochemical test FIT. This test detects hidden blood in the stool. Guaiac-based fecal occult blood test FOT. Similar to FIT, this test identifies blood in the stool that may not be visible. Fecal DNA test. This test examines genetic mutations and blood products in the stool. Flexible sigmoidoscopy. A flexible scope called a sigmoidoscope is used to visualize the lower colon and rectum. Virtual colonoscopy. This X-ray procedure identifies polyps, tumors, and ulcers in the colon and rectum. Staging colon cancer. Healthcare providers utilize the TNM cancer staging system developed by the American Joint Committee on Cancer to determine the stage of colon cancer. The staging system comprises 5 stages, with 3 substages in 3 of the stages. The stages are as follows. Stage 0, referred to as carcinoma in situ. This stage denotes abnormal or precancerous cells in the mucosa, the innermost layer of the colon wall. Stage 1. Cancer has grown into the intestinal wall, but has not spread beyond the muscular layer or nearby lymph nodes. Stage 2. The cancer has spread further into the intestinal wall, but has not reached nearby lymph nodes. Stage 2 colon cancer encompasses 3 substages. Stage 2A. Cancer has spread throughout most of the colon wall, but has not infiltrated the outer layer. Stage 2B. Cancer has invaded the outer layer of the colon wall or penetrated through it. Stage 2C. Cancer has spread to a neighboring organ. Stage 3. Colon cancer has reached the lymph nodes. Similar to Stage 2, Stage 3 colon cancer comprises 3 substages. Stage 3A. Cancer is present in the first or second layers of the colon wall and has spread to 1 to 4 lymph nodes. Stage 3B. The cancer affects multiple layers of the colon wall, but only 1 to 3 lymph nodes are involved. Stage 3B also includes cases where cancer affects fewer layers, but involves 4 or more lymph nodes. Stage 3C. Cancer is found in the outer or next outermost layer of the colon wall, as well as in 4 or more lymph nodes. Stage 3C also covers situations where cancer has spread to a nearby organ and one or more lymph nodes. Stage 4. Cancer has metastasized to distant areas of the body, such as the liver, lungs, or ovaries. Stage 4 is further classified into 3 substages. Stage 4A. Cancer has spread to a single distant organ or lymph nodes farther from the colon. Stage 4B. The cancer has spread to multiple distant organs and more lymph nodes. Stage 4C. Cancer has affected distant organs, lymph nodes, and abdominal tissues. Management and treatment approaches for colon cancer. Surgery is the primary treatment for colon cancer, and various surgical procedures can be employed, including polypectomy. This surgery involves the removal of cancerous polyps. Partial colectomy. Surgeons remove the section of the colon containing the tumor and surrounding healthy tissue. The remaining healthy sections of the colon are reconnected in a procedure known as anastomosis. Surgical resection with colostomy. In cases where it is not possible to reconnect healthy sections of the colon, a colostomy is performed. The procedure involves diverting the bowel through an opening in the abdominal wall, where waste is collected in a bag. Radiofrequency ablation. This procedure utilizes heat to destroy cancer cells. Adjuvant therapy, which involves treatment before or after surgery, is often combined with surgical interventions. Additional treatments may be employed for colon cancer that has metastasized or recurred. These treatments include chemotherapy. Medications are used to shrink tumors and alleviate colon cancer symptoms. Targeted therapy. This approach targets specific genes, proteins, and tissues involved in the growth and multiplication of colon cancer cells. Monoclonal antibody therapy, a type of targeted therapy, utilizes laboratory-created antibodies to target cancer cells or their supporting cells, leading to their destruction. Prevention. Can colon cancer be prevented? While it may not be possible to prevent colon cancer entirely, certain measures can reduce the risk of developing the condition. Avoid tobacco. Seek assistance from healthcare providers to quit smoking if you are a tobacco user. Moderate alcohol consumption. Limit alcohol intake to recommended levels based on sex assigned at birth. Maintain a healthy weight. Adopt a healthy diet. Include fruits and vegetables, while reducing the consumption of red and processed meats, as well as high-fat and high-calorie foods. Moderate coffee consumption may lower the risk of colon cancer. Keep track of family medical history. Inform healthcare providers about any family history of colon cancer, advanced polyps, or cancer diagnosis before the age of 45 among biological family members. Follow colon cancer screening guidelines. Consult healthcare providers to determine appropriate screening schedules, which may be earlier for individuals with chronic irritable bowel disease or a family history of colon cancer. Outlook and prognosis. Can colon cancer be cured? According to the U.S. National Cancer Institute, NCI, more than 90% of individuals treated for early-stage colorectal cancer survived 5 years after diagnosis. Survival rates specifically for colon cancer are not differentiated in NCI data. Survival rates for colon cancer vary depending on the stage at diagnosis. Overall, NCI data indicates that 65% of individuals with colorectal cancer were alive 5 years after diagnosis. Survival rates are influenced by various factors, including the stage of cancer. For example, 73% of individuals with colorectal cancer that has spread to nearby tissues, organs, or lymph nodes survived 5 years after diagnosis. However, the 5-year survival rate drops to 17% if the cancer has metastasized to distant organs or lymph nodes. Survival rates provide estimates based on the experiences of individuals with specific types of cancer. Numerous factors influence colon cancer survival rates, and it is important to consult healthcare providers for personalized information regarding prognosis. Managing life with colon cancer. Self-care plays a crucial role in living with colon cancer, although individual circumstances may vary. Individuals treated for early-stage colon cancer may achieve cancer-free status and become cancer survivors. However, concerns about cancer recurrence may persist. Advanced colon cancer poses different challenges. Although individuals continue to survive with colon cancer, their treatment may focus on symptom management rather than a cure. Palliative care, which addresses symptom management and treatment side effects, can greatly benefit individuals with advanced colon cancer. Consulting healthcare providers. Follow-up care for colon cancer depends on the cancer stage. For instance, individuals who undergo surgery for stage 0 or stage 1 colon cancer may undergo colonoscopies 1 year after surgery, followed by additional colonoscopies at 3-year and 5-year intervals, if no signs of cancer are detected. Individuals treated for stage 2 or stage 3 colon cancer typically require checkups every 3 to 6 months for the first 2 years following treatment. They are generally monitored for 5 years after surgery, and tests such as colonoscopies, blood tests, and imaging studies may be conducted. Anyone recovering from colon cancer treatment should contact their healthcare provider if they observe any changes suggesting cancer recurrence or spreading. Emergency room visits. Individuals undergoing colon cancer treatment should consult their healthcare providers regarding symptoms that may warrant a visit to the emergency room. Emergency medical attention may be necessary if experiencing more severe side effects than expected. A fever exceeding 100.4 degrees Fahrenheit 38 degrees Celsius, persistent chills, severe abdominal pain, or dehydration caused by persistent diarrhea. Questions to ask healthcare providers. People diagnosed with colon cancer often have questions specific to their situation. Here are some questions that may be helpful to ask healthcare providers. What type of colon cancer do I have? Can this type of colon cancer be cured? What is the stage of my cancer? What are the most effective treatment options for colon cancer? If surgery is recommended, what kind of procedure is suggested? Will a colostomy be necessary? Are there additional treatment options besides surgery? What are the potential side effects of these treatments? Are there any clinical trials available for my condition? What is the likelihood of cancer recurrence? If the cancer cannot be cured, can it be contained or managed? Is palliative care appropriate for my situation? Thanks to increased awareness and screening, more cases of colon cancer are being detected and treated at an early stage, reducing the risk of symptoms and metastasis. Recent survival rate data indicate that over 90% of individuals treated for early-stage colon cancer survived 5 years after diagnosis. New treatment options targeting cancer cells have also improved outcomes for individuals with colon cancer. When diagnosed with colon cancer, consult healthcare providers to explore the latest treatment options suitable for your specific case.
Stay tuned for our next episode, because at Health Beat Now, the pursuit of well-being never stops.